Okay, good morning, everyone. We have a great group in the room and a good group online as well, so we're going to go ahead and get started. We wanted to say welcome to the 5th Annual Global Social Service Workforce Alliance Symposium. I am Amy Bess, the Director of the Alliance, and we're happy to be hosting today's event. We're thankful to the support from the United States Agency for International Development through the President's Emergency Plan for AIDS Relief, or PEPFAR, the GHR Foundation, UNICEF, Celsus, and TPO Uganda. It's pretty amazing to think that just 7.5 years ago was the conference on social service workforce strengthening in Cape Town, South Africa, and less than 5 years ago that the Alliance was formed. This field has really come a long way since then, due to the hard work of so many people in this room and who are listening online. And these people share one thing in common, that they're very committed to two key things. One, that the social service workforce is the most important driver of change when trying to improve systems of care for children and families. Without them, there really would be no services provided, no community-based prevention programs, basically no systems of care in place. And two, the social service workforce needs to be adequately resourced and supported in order to effectively work with families and communities to bring about positive change. So today we'll be talking about some of the crucial foundational elements that will need to be in place in order to fully realize these two things. We'll hear from 3 countries who are putting into place coordinated, comprehensive workforce strengthening plans. Coordinated in that it's a government-led process that engages stakeholders such as NGOs, civil society, universities, associations, and key donors from the various sectors that contribute to improving the lives of children, families, and communities. And it's comprehensive in that it looks at all elements of planning, developing, and supporting the workforce, and the various aspects of social service systems that need to be in place to strengthen the workforce. A worker can really only be as good as the service in which they're working, the system in which they're working. So these initiatives are the foundational elements that are also outlined in a call to action that we're issuing today. We've joined with a number of organizations to call on national and local governments to strengthen the social service workforce. The call to action is based on the belief that we must work together to improve protection, health, and well-being outcomes for children, youth, families, and communities, as outlined in the Sustainable Development Goals. Toward the end of today's event, our final panel of speakers will discuss the call to action and ways that their organizations are supporting it. And we'll be adding organizations who are interested in signing on. So please do let us know if you would like to join the call. There are copies in the back and also on our website if you'd like to take a look. So none of this progress over the years would happen without the commitment of a lot of people. I've been very honored over these past years to work with many outstanding and very impressive people, including our steering committee, who is here in town for a few days for our annual in-person meeting. So thank you to all of them. To our Alliance ambassadors and our interest group members and our membership at large. We have a membership now of 1,800 people across 121 countries who come together to exchange promising practices, develop new tools and resources, and advocate for workforce strengthening. So we hope that you'll take a look at the table in the back, and for those online, take a look at our website to find a number of new resources, including our 2017 State of the Social Service Workforce Report. It features an analysis of stories from workers about ways that they have helped families affected by violence. And all of the resources that the Alliance has produced have benefited from the input of hundreds of our members. So we hope that you'll get involved in our webinars and annual events such as Social Service Workforce Week that's happening in September this year to highlight all of the good work that you are doing and share it with others through the network. I think together we can do a lot more than we could alone to build the evidence base and to advocate for improved services for families. So we look forward to everyone's continued engagement in this work, and for anyone who's not yet a member of the Alliance, we hope that you'll join us and share your experience and knowledge with others in the network. So we do hope that you'll enjoy today's event. We've left time after each panel for some discussion, and we'll also have a chance to have some interactive discussion at the lunchtime learning exchange tables. Your program does provide bios for each speaker, so each of the panel moderators will just be introducing speakers briefly, and you can take a look at their bios in the program. But let me go ahead and introduce our first speaker today. Dr. Alma Crumm Golden is the Deputy Assistant Administrator in the Bureau of Global Health at USAID. She's a pediatrician by training, and Dr. Golden has worked in private pediatrics, indigent health services, academic medicine, public health, healthcare administration, and health policy. She's also served as a presidential appointee from 2002 to 2006 as Deputy Assistant Secretary for the Office of Population Affairs in HHS. We're very happy that Dr. Golden is joining us today, and join me in welcoming her. Thank you.
I am deeply honored to be here today, both in terms of getting to meet you and in being able to represent USAID. I had, she read a list of the jobs I've done, which makes it sound like I can't keep a job. But I had actually started to retire when I got a phone call about coming and working with USAID. And I think Dr. Madrid would probably agree with me that to have an opportunity to do a job like this, where you get to advocate for children and for health services around the world, is just a job you can't turn down. And I'm delighted that I've been there now for almost 7 months, and I'm thrilled with the opportunities that it presents. I'm especially drawn to the area of social work, and I will tell you several reasons why. During my time as a pediatrician, one of my favorite decades was a decade I spent doing maternal and child health work. And we did this in rural East and South Texas, which actually has some pretty significant needs, not the same as what you have, but there are some commonalities. We had a lot of immigrants and indigent. And one of the things that was my key to being able to address some of the really difficult needs I saw was the workforce of the social services in the different counties where we had clinics. And it really made me aware of how critical the connection is between a child and a family in need and the resources that can actually make a difference on whether that child thrives. I also have another very special connection that's happened in the last week. There's a young couple, a young family, Daniel and Joy, and they are down in Pearland, Texas, and just less than a week ago, they got their confirmation that they've been approved to serve as foster parents. And they have other children, but they felt like they had space in their home for children in need. And so probably this week, they will get their first infant in foster care, and that's especially important to me because that's going to be my first foster grandbaby. So I'm pretty excited about that. Daniel is my youngest son, and it's thrilling to see this wonderful heart of wanting to give and participate. And I think part of it comes from the extraordinary gift that his wife is. She was adopted at birth. And so she was raised in an adoptive family, and her heart is to take care of children who need a place to be loved and to find bonding and strength. And she really is such a gifted woman in that. And I'm delighted that I have the benefit of social workers that are not only identifying safe places, but placing children that have real needs in those safe places, and also working toward a long-term plan for them. So I have a special connection with y'all on that. I also recognize that what you do in social work is much like what our Administrator Green, the gentleman that is our lead in USAID, talks about. He talked about the foreign aid our goal is to end the need for its existence. We want to do things so well that we don't have to stay there. And that's really the same thing you want to do as social workers too, and that all of us need to be able to address. We want to intervene in a way that we actually make things better and we don't need to stay there the whole time. One of the things that I think is most exhausting for a pediatrician or a social worker is to deal with the issue of violence against children. And I know there's a focus on that with your meeting today. And also that was a focus in terms of your workforce report. I noticed a couple of things in there. One of them had to do with how equipped the social service workforce is in terms of addressing violence. There were about half of the members that responded, as I understand, that said they didn't feel like they were well prepared to address violence. And those that felt like they were prepared really wanted more tools and support. I will tell you, I think that if you surveyed pediatricians, you'd probably see a similar response, because all of us are pretty humble about how we respond to children who've experienced violence. But that means we all need to work together to be sure that we are identifying the tools that are there and using them well as we move forward. Certainly we want to acknowledge that we've got USAID and the CDC in coordination with UNICEF and Together for Girls have worked on the survey, the Violence Against Children survey. And as you're probably aware, that's been completed in 14 countries. It's actually ongoing now in 5 more. And how we use that data is really important, particularly as we move forward and start developing the comprehensive plans of action with government. I encourage you to use all of that data well and let us know how to partner with you as you move forward on that. We also want to acknowledge the global initiatives like the World Bank's the World Health Organization's Inspire resource, where it looks at the 7 different strategies that have been evaluated and that we need further to see how it can be adapted to different environments, because we know that sometimes something that works in one place doesn't always completely work in another place, and so your involvement and direction on that is very important. I want to mention another thing that we care a lot about at USAID, and that comes from our administrator all the way down, and that is that we want to be sure that everything we're involved with first does no harm. And that is going to take your eyes and ears and hearts as well. We want to be sure that any program that we're working with has the highest level of accountability and respect toward children. And we want to be sure we identify any harassment, abuse, anything that could violate children in any way. And just know that we will stand with you on that if you sense that there's any problem in terms of how children are handled or exploited. The other thing I want to talk about briefly is the DREAMS initiative. Many of you are already pretty familiar with that. It's funded under the President's Emergency Plan for AIDS Relief, and you may already know that it's like the program that Ambassador Birx is most proud of, and for good reason. DREAMS is a program for girls. It's primarily been for 15 through young women, maybe into their early 20s, and it stands for Determined, Resilient, Empowered, AIDS-free, mentored, and safe, okay, which is a great set of attributes to have for our young adults. There is a story I heard about a young woman in Nairobi not long ago who had gotten pregnant, gotten into drugs, ended up in jail and in trouble with her parents, and just really had created quite a mess for herself. And as she got out of jail, she was having trouble living with her folks because of the difficulty, but she already had a child, and so there were lots of complicating factors. She got into the DREAMS program and was encouraged and helped to get through school. She finished a certificate program so she could do hairdressing. She started making money, managing her money, taking care of her child, staying with her parents, and now she is planning to run for public office. Thank you. So, she's going to be sure that she is an example and a contributor contributor to society. And I think it's the kind of thing that we're seeing social work actually be the key to. And it is, there's evidence already that the DREAMS program may turn out to be one of the most successful, if not the most successful, prevention programs that we've had in HIV/AIDS. I want you to know of our deep appreciation for your contributions to that. And I believe that actually you may be the key to what actually changes the AIDS epidemic, and we want to be your partners on that. I think it illustrates something that we kind of were talking about at our little table tete-a-tete a while ago, in terms of how do we change trajectories. As an old pediatrician, when I first went into practice, I thought if I handed somebody a pamphlet on asthma, they would never have problems with their asthma again. I would thought if I just educate them a little bit, that would help. But really, we know that it takes not only knowledge, but it takes attitude change and skills. But the thing that predicts whether you really change a trajectory has to do with their support system. And you all are engaged in the support system. And that's what's making the difference on the DREAMS initiative, is connecting to a support system and then helping those girls reconnect, as this young lady in Nairobi did, reconnect to family and friends, and also be a parent that she needs to be, so the relationship she has going forward with her family, future spouse, and her children are secure. So basically, we want to encourage you to be involved with lots of different agencies and initiatives in the countries where you are working. And we want to acknowledge the example we have of Uganda here today, and the fact that we've been able to work as USAID with Uganda. We've really invested, USAID has invested like $500 million in Uganda, and we have this wonderful partnership there that we just wanted to do a shout out to Lydia Joyce and Timothy and Patrick, thank you. And we wanted to particularly note that we've helped on the workforce analysis, and along with our partners in Uganda have been able to identify where the workforce needs are. And we also have been able to have reduced the number of vacancies and also improved filling positions. And also one of the things I'm excited about is they've got a new cadre of parasocial social workers, or parasocial service workers. That's what I think it is. And I think that's one of the things that we need to identify, because sometimes we do need partners in the community we clearly need the leadership of social service workers, but having additional help for them is useful, and then recognizing how to recruit appropriate support from the community, whether it's from, like in the United States, we have something called CASA, the Court-Appointed Special Advocates, which help to address some of the social needs for children, and they're trained, but they're not like professional social workers, and they're volunteers. Same thing for some of the faith-based. So I encourage you to look for your resources on that. We also saw that with the national and district social service leadership and coordinating bodies, we've been able to work with Makerere University and the ministry to help look at case management and training and so forth. And finally, the National Association for Social Workers and USAID also have been working on equipping with service models and case conferencing and other things to sort of improve the function of the social work service. But the payoff is real, because one partner reports a 50% increase in the number of child protection cases resolved or closed in targeted districts, and that's what we want. We want these children taken care of in a clear and supportive way. So bottom line, we're honored to be founding members here, and we're thrilled with your excellent progress, and we want to be your partners going forward until we come to the point where social service, just like foreign aid, is no longer needed. So I do want to do a quick shout out, though. Most of you are familiar and know the lovely young lady named Mari Mendenhall, okay, and she has had a health issue just this last weekend, which was a cerebral hemorrhage, and she is still in the hospital instead of being with us today. So we're going to send around a get well card for her, and I know she would be thrilled with a signature or just a tiny little note or draw a smiley face, I don't know. And let's let her know how much we appreciate all of her hard work on this conference, and that our appreciation and prayers and thoughts are going out to her as she recovers. So thank you very much.
Thank you so much, Dr. Golden. We're really happy that you're here with us and could provide those remarks. And yes, and I encourage everyone to sign the card for Maury. She's definitely missed today. Next, we are happy to welcome Kirsten Di Martino. She'll be providing our next keynote address. Kirsten is the Senior Advisor in the Child Protection Section at the UNICEF headquarters in New York. She's a lawyer by training, and she has over 20 years of experience in human rights, and child protection programming, including 17 years of experience with UNICEF in Kosovo, Moldova, China, and Lao PDR, and more recently in Germany, where she led UNICEF's refugee and migrant response. So, Kirsten, I invite you to make your remarks. Thank you.
Thank you very much, Amy. So, distinguished guests, ladies and gentlemen, first of all, on behalf of UNICEF, I am extremely pleased to have been invited today to address the 5th Annual Social Services Workforce Strengthening Symposium. I would like to thank especially the Global Social Services Alliance and all those present today for giving me this particular opportunity to be here, not only to listen to you, and to continue a very important conversation on how we can further strengthen the social services workforce to build strong child protection systems that can better protect all children from violence and abuse. I would also like to thank our partners and event sponsors, especially USAID, PEPFAR, GHR Foundation, CELSIS, and TPO Uganda for today's event and their ongoing support. I am particularly honored and humbled by the fact that as a human rights lawyer specializing in child rights and child protection, I have been given an opportunity to address such a distinguished audience of experts and practitioners in the field of social services. Over the course of my 18 years with UNICEF, I have worked in low, middle, and high-income countries, large and small countries, in emergency and post-emergency situations, and in different political contexts. In all these places, I've witnessed firsthand how essential a qualified and well-supported social services workforce is to child protection. I have relentlessly advocated for governments to give this the attention that and the priority it deserves. Child protection laws, policies, and services simply mean nothing if there is no motivated cadre of social services workers in place to drive the system and help the most at risk and vulnerable children and their families to get the support they need. Ladies and gentlemen, as the world becomes more and more connected and more families and children are on the move, national child protection systems are struggling to meet the specific needs of over 28 million children globally who are refugees, asylum seekers, or living in forced internal displacement. A further 20 million children have left their homes and migrated across international borders and are also at risk. In this context, cross-border and multi-sectoral coordination has become even more essential to ensure that child protection systems are inclusive of all children and that no child is left behind. The social service workforce at the heart of these systems are being challenged to adapt to these changing realities, to find creative ways to work together and to meet the needs of families and children on the move who have all too often experienced discrimination, exclusion, extreme violence, in their countries of origin, in transit, and in the countries of destination. I have just returned from Nairobi, Kenya, where I was last week, and I participated there in a review of a UNICEF-supported multi-country program to address violence and exploitation of children on the move in Somalia, Ethiopia, and Sudan. The Horn of Africa, as many of you know, is a key migratory route which exposes children to significant risk. In Somalia alone, almost 600,000 children moved from their homes in 2017. And yet, only Somaliland has 20 qualified social workers employed by the government, and only one university which is offering a social work degree. The challenges are absolutely enormous. All countries in this region have identified social services workforce strengthening as a pressing priority and much needed as an intervention to identify, track, and protect children on the move, and are all committed to professionalizing this workforce. Strong leadership and multi-sectorial coordination is a prerequisite for the development of this workforce. As such, I am particularly pleased that this year's symposium focuses on countries that have formed multi-sectoral coordination mechanisms to develop and implement comprehensive strategies to better plan, develop, and support the workforce. As we will hear from the country-based panels of speakers later today, these multi-stakeholder groups play a critical role at the national level in advocating for a strong workforce, engaging the highest levels of government, and bringing all relevant actors to one table to bring greater visibility to this topic and to elevate the discussion to the highest levels of decision-making. The role of the social services workforce, especially the role of social workers, is still not well understood in many countries, and the diversity of workers who constitute the social services workforce often makes it difficult to define and articulate this area of work. These multi-stakeholder groups have helped to bring greater recognition to the workforce and the critical role it plays in child protection. Ladies and gentlemen, the adoption of the Sustainable Development Goals, and specifically goals and targets to prevent and respond to all forms of violence against children, represent an unprecedented opportunity, both nationally and globally, to address violence, exploitation, abuse, and neglect of children. They have also given greater prominence to the role of and the need for a well-developed social services workforce to address violence against children. More and more countries are turning their attention to building this workforce and this system, and are asking UNICEF and other partners for assistance. For the first time, social services workforce strengthening has also been identified as a priority strategy and intervention under UNICEF's new strategic plan for the period 2018 to 2021. It is viewed as key to achieving Goal 3 of this plan, which is every child is protected from violence and exploitation. UNICEF's global experience in supporting child protection system strengthening has demonstrated that a well-planned, well-trained, well-supported social services workforce plays a central role in identifying, preventing, and managing risks, and responding to situations of vulnerability and harm. A key lesson learned from the implementation of UNICEF's previous strategic plan for the period 2014 to 2017 is that, and I quote, "A trained social service workforce that is in contact with families and communities is vital to child protection." Similarly, the 2015 evaluation of UNICEF's programming around violence also identified the workforce as among the weakest links in building child protection systems, and urged that workforce strengthening become a priority. States need to recognize the indispensable role and valuable contribution that the social services workforce makes to achieving the SDGs. They are the eyes and ears on the ground and often the first to respond to cases of violence. Their ability to perform and the impact of their work depends on receiving the proper political, human, and financial support. In order to address these priorities, UNICEF is working in close partnership with the Global Social Services Alliance and other partners at regional and country level to support national efforts to strengthen the workforce. I would like to take this opportunity to share with you just some of the key steps that UNICEF is taking in this respect. First, in partnership with the Alliance, UNICEF is supporting countries to map the state of their social services workforce. Multi-country mappings of the social service workforce have been completed in 8 countries in South Asia, and mapping of 6 countries in East Asia and the Pacific, and 9 countries in the Middle East and North Africa is currently underway. The outcome of these assessments will guide regional country efforts to improve policies and programs to strengthen the workforce. This is the very first step in planning for and supporting the development of such a workforce, and requires strong leadership through multi-sectoral coordination to ensure that the mapping exercise is entirely effective. Second, UNICEF is developing program guidance on strengthening the social services workforce. This guidance is informed by evidence of what works and lessons learned, what works on the ground and lessons learned globally. It is intended to provide guidance to states, national stakeholders, and UNICEF country offices as they support national partners on what strategies and steps to take to plan, develop, and support this workforce, and to strengthen child protection systems to achieve the SDG goals by 2030. Third, UNICEF is supporting efforts to strengthen data collection in this area. Data is not only important for measuring quality, accountability, and coverage, but data also brings visibility to this area of work by strengthening the evidence base and informing much-needed policies and laws. Without visibility, the importance of the work of social service workers is less likely to be as well understood and to obtain the political attention it needs to ensure greater investment in this area. UNICEF's Strategic Plan 2018 to 2021 contains 33 indicators on child protection, including 2 that relate specifically to strengthening the social workforce. The first is intended to measure the number of girls and boys who have experienced violence reached by health, social work, or justice law enforcement services. And the second one is intended to track the number of countries with a quality assurance system in place for social service work. Baseline data for these indicators was collected in 2017 from 157 UNICEF program countries. A country will be considered as having a quality assurance system in place for social service work if it has a normative framework, a system of supervision and support, a system for licensing and accreditation, and a nationwide data collection system for the workforce. Fourth, UNICEF is focusing on efforts to strengthen the case management system and tools, a core function of the social services workforce. Quality case management practices not only improve decision-making based on the best interest determination, referral, and service delivery in child protection, they are also essential to prevention efforts, identifying the most at risk and making sure that no child is left behind while ensuring quality, consistency, and coordination of services. The use of good case management practices is equally important in both emergency and non-emergency scenarios, and especially relevant, although extremely challenging, in the context of children on the move. Good case management requires good information management. More and more countries are investing in the development of and use of innovative information management system tools to support case management systems and strengthen cross-sectoral and cross-border collaboration. To this end, UNICEF and partners had developed and tested a new software platform called Primero. This platform combines global best practice and open source technology to bring user-friendly solutions to case management for both emergency and non-emergency settings. Primero is intended to be a global public good for the social service workforce. Ladies and gentlemen, UNICEF's corporate commitment to strengthen the child protection system emphasizes the importance of expanding this workforce at country level. The workforce is now recognized as the single most important ingredient of a child protection system. Establishing a qualified, whether professionally trained or community-based para-social services workforce is critical to establishing this system. No system can function effectively without the individuals and the persons that make that system come alive. Thank you very much.
Thank you to you both once again. Please join me in another round of applause for our presenters. Thank you very much.